Assalamu alaikum, this is me Afshan Jabeen. My topic is gout arthritis, rheumatoid arthritis, and osteoarthritis. Pharmacotherapy of gout. Gout involves hyperuricemia, recurrent attacks of acute arthritis with monosodium urate crystals in synovial fluid, deposit of monosodium urate crystals in tissues and around joints, interstitial renal disease, and uric acid nephrolysis. Its epidemiology includes 41.2 million gout in the world and 7.4 million cases per year. Nearly 1.3 million people lived with disability of joints, knees, and different movable joints in our body. Uric acid pathophysiology is due to the purine degradation. Overproduction of uric acid may result from abnormalities in enzyme system which regulate the purine metabolism. Deposition of urate crystals in synovial fluid results in inflammation, vasodilation, increased vascular permeability, complement activation, and chemotactic activity for polymorphonuclear leukocytes. The ensuing inflammatory reaction causes intense joint pain, arrhythmia, warmth, and swelling. The clinical presentation of gout include pain, swelling, inflammation. Affected joints are erythematous, warm and swollen. Fever and leukocytosis are common. Gout symptoms which we should never ignore: pain that rapidly worsen, pain in knee, ankle, wrist or elbows, kidney stones because due to the higher level of hyperuricemia in our body, strange lumps around your joints, toffee, pain in the big toe. Diagnosis: we can diagnose acute gout या gouty arthritis by the aspiration of synovial fluid from the affected joint or by the monosodium urate crystals in synovial fluid leukocytes. If joint aspiration is not feasible, then presumptive diagnosis is based on the presence of characteristic signs and symptoms as well as the response to treatment, which vary from patient to patient. Non-pharmacological treatment include use of local ice application. As our joint has swollen, so we use localized application for the soothing. Next है, flax seeds, celery roots are not recommended as a dietary supplements. Pharmacological treatment include NSAIDs, corticosteroids, and colchicine. These are the three main categories of drugs which includes in pharmacological treatment. NSAIDs further include indomethacin, naproxen, and Solendec. Corticosteroids include prednisone, triamcinolone, acetinoid, adrenocorticotropic hormone, colchicine. These are the brands which indicate the main drugs of acute gout. नेक्स्ट हमारा है osteoarthritis. Osteoarthritis, shortly OA, is a common progressive disorder affecting primarily weight-bearing arthroidal joints, characterized by progressive deterioration and loss of articular cartilage, osteophyte formation, pain, limitation of motion, deformity and disability. ओस्टियोआर्थराइटिस हमारे पास जो है उसमें हमारे जो वेट बेयरिंग जॉइंट्स होते हैं हमारी बॉडी के अंदर वो क्या हो जाते हैं, डैमेज हो जाते हैं, डिटोरिएट हो जाते हैं, जिसकी वजह से मोशंस और मूवमेंट क्या हो जाती है, लिमिटेशन हो जाती है उसकी, और डिसेबिलिटी और डिफॉर्मिटी की तरफ मूव हो जाता है हमारा मूवमेंट. पैथोफिजियोलॉजी क्या है? ओ यूजुअली बिगिंस विद डैमेज टू आर्टिकुलर कार्टिलेज थ्रू इंजरी और जॉइंट इनस्टेबिलिटी और इंजरी. Damage to cartilage increases activity of chondrocytes in attempt to repair damage, leading to increased synthesis of matrix constituents with cartilage swelling. Clinical presentation. Risk factors include increasing age, obesity, repetitive use through work or leisure activities, joint trauma and genetic predisposition. Limitation of motion, stiffness and deformities may occur. Osteoarthritis symptoms which should never ignore: pain, stiffness, tenderness, grating sensation, swelling, bone spurs. We can diagnose osteoarthritis by the recommendation of American College of Rheumatology. Criteria of the hips, knees and hands include presence of pain, bony changes on examination, normal erythrocyte sedimentation, and radiographs showing osteophytes or joint space narrowing. These three were the main diagnostic factors as according to the American College of Association. We should remember it. Now the pharmacological treatment of osteoarthritis, it is categorized according to the joints. Knee and hip osteoarthritis can be treated by the following medicine: acetaminophen or topical NSAIDs, intra-articular corticosteroid injections, tramadol, opioids, duloxetine. And the pharmacological treatment for hand osteoarthritis include topical NSAIDs, oral NSAID, capsaicin cream, and tramadol. These are the brand categories which are involved in the pharmacological treatment of osteoarthritis. नेक्स्ट हमारा पार्ट है rheumatoid arthritis. Introduction. Rheumatoid arthritis is a chronic progressive inflammatory disorder of unknown etiology characterized by the polyarticular symmetric joint involvement and symmetric manifestation. Epidemiology affects 1 to 3% of the population worldwide, with a peak prevalence between the age of 30 and 50 years. Women are affected 3 or more times effectively as compared to men. Pathophysiology of RA, rheumatoid arthritis, results from the dysregulation of humoral and cell-mediated immunity. This is the category of arthritis which is regulated by the cell-mediated immunity. Most patients produce antibodies called rheumatoid factors. Immunoglobulin activate the complement system, which amplifies the immune response by enhancing chemotaxis, phagocytosis, and release of lymphokines by mononuclear cells that are then presented to T lymphocytes, which is then recognized by histocompatibility complex protein, resulting in activation of B and T cells. Clinical presentation include joint swelling, visible होगी, apparent only by palpation, tissue soft, spongy, warm, and erythematous. Extra-articular involvement, rheumatoid nodules, vasculitis, pleural effusion, pulmonary fibrosis, and maybe the pericarditis, the cardiac dysfunctions. Rheumatoid arthritis effects on the body. We can categorize this as the main symptoms due to rheumatoid arthritis in our body: constipation, ulcers, joint pain, bone damage, anemia, brain fog, dry eye, dry mouth, scared lungs, finger abnormalities. Diagnosis: normochromic anemia, thrombocytosis or thrombocytopenia, leukopenia, elevated erythrocyte, ESR, C-reactive protein, positive rheumatoid factor, 60 to 70% of patients. These two are the main categories for the diagnosis of rheumatoid arthritis. Number 1 is C-reactive protein. Number 2 is anti-citrullinated protein antibody, 50 to 80% of patients. Positive anti-nuclear antibodies, 25% of patients. Pharmacological treatment for the rheumatoid arthritis includes DMARDs, which include methotrexate, hydroxychloroquine, sulfasalazine, and leflunomide. Anti-TNF agents: etanercept, infliximab, adalimumab, certolizumab, and golimumab. Anakinra is an interleukin-1 receptor antagonist. Corticosteroids. These four are the main drug categories used to treat the rheumatoid arthritis. These are the brand categories which show the brand, their brand name, their manufacturers, their dose, strength, packaging of this disorder, rheumatoid arthritis. This is a basic difference, some points which shows difference between the rheumatoid arthritis and osteoarthritis. Rheumatoid arthritis affects our whole body, while osteoarthritis affects only joints. Rheumatoid arthritis often starts in hand and feet and joints, while osteoarthritis knee, hip, joints at the end of your fingers. Usually, if rheumatoid arthritis usually affects the same joints on both sides of body, while osteoarthritis affects a joint on just one side of body. These are the main differentiation point through which we can easily differ rheumatoid arthritis and osteoarthritis. This is abstract number 1, which shows that the drug rheumatoid arthritis, gout, uh, its medication can lead to the cardiovascular diseases. Second, my second abstract is इटोरिकॉक्सिब, जो कि हमारे पास कॉक्स 2 इनिबिटर है, जिसकी वजह से क्या होती हैं, सिम्टोमेटिक ट्रीटमेंट होता है ऑस्टियोआर्थराइटिस रूमेटॉइड आर्थराइटिस का. These two are the references of my abstract. Thank you. Allah Hafiz.